Hi, everyone, and welcome to this episode of Ask a Death Doula. Today, we are going to talk about how to be a tele doula. Before we begin, I want to remind you that the Death Doula Discovery webinar, the live webinar, is coming up soon. And if you are looking for a new profession that you want to find fulfillment, passion, and service, live in service, come to the Death Doula Discovery webinar. The link is in the show notes. It is live. I'll answer your questions. It's an absolutely amazing movement. Okay, how to be a tele doula. So let's first start out with what is a death doula. A death doula is a non-medical holistic practitioner that is there to care for somebody physically, emotionally, and spiritually at the end of life. And this is critically important to understand that death is not a medical experience, it's a human one. And we lost our way with this. So over the last about 180 years, we've outsourced dying and aging and all of the natural sacred experience that go with this life's journey. Yes, it's very hard to say goodbye, obviously, to somebody that we love. But can it go well? It can go really well with the right education, kindness, and support. And that's what Doulagivers Institute stands for, getting free education out to everyone in the world, no matter where you are, so that you have the opportunity to have that positive end of life with yourself and with those that you love, that we know that we're going to be called to care for at some point. So let's talk about the professional death doula for a minute. It is a movement that is global now. In 2017, Time magazine named death doula as one of the top 10 new professions in the US. It is a global movement now. They are all over, and it is so exciting, and it makes perfect sense. Death is not a medical experience, and our medical staff has very limited amounts of time that they can actually be present with patients in general. End of life is 24/7. And right now, 98% of the end of life care is done by family caregivers when they usually don't know the first thing about how to do that care. The hospice nurse, beautiful model of care, and these workers are incredible. But when I was a hospice nurse, I'm a former hospice nurse, I was in the home of an end-of-life patient for 1 hour once a week, if that person was what you call stable, following the natural, which most do, natural end-of-life process. I am supposed to teach the loved ones how to do that care. With 1 hour once a week, the average time that people are on services is about 16 days on hospice. It does not work. Death is the number one fear in the world. When fear is in front of us, people can't absorb any teaching whatsoever. This model is not working, and end of lives are happening to be about 1,000, if not 10,000 times more difficult than they need to be for both the person at the end of life and their loved ones. This needs to change, and the change is now. So a death doula is that non-medical support to the patient, the family, and the hospice team. So what is a tele doula? So for doula givers, we have our doulagiver specialist, and that is that beautiful full spectrum end of life care provider. So it is planning ahead. The doula, it has a death doula training within it, which is incredible. And then it's an elder care doula as well. So we cover the continuum of all things aging, end of life, grief, and legacy, and after that person dies, to really help the family through that whole journey, which is a very intense and can be a very long journey. And so we have our doula givers are taking the Doulagiver Practitioners course. That's the Doulagiver Specialist Practitioners course. We offer one full spectrum end of life practitioner course, which is incredible. A death doula training is within it. So let's talk now about tele doula. In today's podcast, I'm going to tell you what a tele doula is. I'm going to tell you why a tele doula is important, why we need tele doulas, and then I'm going to tell you how to become a tele doula, what you do. So what is a tele doula? Just like it sounds, it is a doula that works through technology. So it's not in person, it's live through technology. So let's talk about what happened during COVID and how telehealth really took off. So when we couldn't physically go in the homes of or have appointments with people, and at one point during the pandemic, they were saying, don't even come to the hospital. We can't accommodate any other people. Telehealth became prominent and the dominant way that, and it's here to stay, by the way, it became the dominant way that people practice. They realize that they can do more, they can have more clients, they can have more interaction. People don't have to leave their homes. There's just so many positives to understanding how we can connect live at from the comfort of our own homes through technology, and it works just as well. And so using Tele Doula, when we were in the pandemic, we were never busier. We were in New York City. We were at the epicenter of how it started, and we were never busier. And we're the End of Life Education, Premier Education Institute. We were never busier and called to show up for everyone, even medical practitioners, family members, people that were just, we all were, I think, just rocked by what was happening. And so we knew that we couldn't go in as practitioners. We couldn't go in as practicing death doulas or doulagiver practitioners into the homes because of the safety that went with that. So what do we do? Do we just there? And I have to tell you, there were people that said, we just have to wait this out. No, we are asked to show up today more than ever. Tele Doula. So Tele Doula was officially born within Doulagivers during the pandemic quickly. We had 3 life cafes a week. We had Tele Doula trainings and classes, and taught our practitioners how to do that. Now, I'm going to tell you that I was doing Tele Doula work for years before the pandemic. Because why? Because first of all, we don't have death doulas everywhere that we need them. And we also have families, and this is very important for you to hear. There are families that actually don't want another person in the home environment. Why? They're too stressed out. There's too much going on. There's family members that are all having different reactions to this end of life with somebody they love. It is usually a crisis and what you call fight or flight energy, because we don't prepare for it, so that when it shows up, it's all kind of frenetic. Bringing another person into that environment is not always beneficial or what the family wants at all. And patients are extremely private. They really don't like people coming in. They're dealing with their own acceptance over what is happening. So all these kind of people emerging and coming in and having different guidance and ideas, it's overwhelming and it's too much. And it doesn't work a lot of the times when, again, we're meeting right now in that crisis place of frenetic energy. So what you want to do as a teledoula is understand that you work right alongside the main caregiver. You're here supporting and educating that main caregiver. And so I was doing teledoula for years before the pandemic, and it worked beautifully. I'm going to see if I can retrieve some of the incredible texts that I have simply from my teledoula work. I remember going to Washington to talk about doulagivers, and in this, beautiful conference about, the future of healthcare. And I was, in the airport, and I remember being the teledoula for a family in Long Island. This woman her mother was dying, and literally, texting back and forth through the vigil period when she entered her transition, through the vigil period of actively dying, giving suggestions, telling them when I thought, again, contacting the hospice nurse was this moment, because a lot of families don't know when to contact on-call hospice or what's happening. Walking her through that in the airport lounge for hours, by the way, this was probably over a day and a half that she was really in her actively dying. And it worked incredibly well. This woman knew what was happening when she would describe to me what her mother was presenting like with her breathing and the things that you will learn as a doula giver. She was able to then understand that the body was shutting down and that, we were getting close to the time that body was physically going to die through texting, through technology. Now I had phone calls with this woman, and then I had texting with her, and that's how I did the teledoula for her. And again, it worked out beautiful. So teledoula is critically important for a few reasons. Number one, that sometimes, many times, families don't want another person in. The caregiver might want a teledoula, or I'm sorry, a doula, but the other family members might be just overwhelmed and say, what we don't, want more people in. So you want to be mindful that there's so many family members that are attached to this end of life scenario. And again, 80 to 90% of a positive end of life is planning ahead. Because when we get there, it's not this frenetic shock that it is right now. And nothing can really go well in that kind of energy. However, we have it go as well as possible. So a tele doula is simply a death doula that does it through technology, and it works beautifully. So why is it important to have tele doulas? Why is it important to know how to be a tele doula? First of all, it's critically important to know how to be a tele doula for several reasons. Number one, like I just said, sometimes families don't want another person in that area, physically in that dynamic. But another reason is, as a professional death doula, it does not limit you to your geographical area. You can work with people all over from the comfort of your home. We had a doula giver who is in England working with a family in Ireland, and I love that. So people who speak Spanish, we have so many beautiful certified doulagiver practitioners that speak Spanish are able to work with multiple different Spanish-speaking countries and offer their services. So knowing that you can work through the comfort of your home as a death doula through technology, and if that's the only thing you want to offer as a tele doula, by all means do it. So if you are somebody who has physical limitations or lives in a rural area or is something that you can't get to for whatever reason, maybe something's going on with you, or maybe you're older and you really are being called to do this work, but you're worried about the physical taxing of getting to different families' homes and all of that. You don't have to. You can literally practice as a tele doula. So let's talk about the benefits again. If something like COVID or disease processes happen, and let's knock on wood, we hope they won't again, but the reality is we want to be prepared, because being prepared ahead of time makes things so much better when we actually get there. So if there's situations like that that arise, we are well adjusted and ready to go. You're working with people anywhere. You don't have just the limited geographical location of where you can drive to, where you can get to. That opens up the whole entire world for you. You can put your services online and you can advertise a tele doula and work with people anywhere in the world. Amazing, right? And many times families don't want another person. Now you can also do a hybrid where you can be working with people, having an in-person visit at times, and then working with the caregiver through technology, through text, through things that, again, you had a great first visit, you had an assessment, you met people, but it doesn't mean that you have to be there every time. This is not how this works. You're that end of life guide. You are a coach, and people will say, well, how much physical work does a death doula do? Our death doulas and many death doulas, zero. You don't do physical care. You do no physical care. Think of yourself as an end-of-life coach. What a coach does is gives the education, support, and tools and guidance to the caregiver, to the family to do the care. That's what we're here to do. So there's a huge gap in education and understanding about end-of-life care, yet that's what we expect families to do. So hospice manages the medical care of that patient and family. It's supposed to teach the family how to do the care. There's a huge gap there. It's virtually impossible for the hospice team to do that and do that well with the time restrictions, the short amount of time, the fear that's there, all of the variables that are creating this very dysfunctional end-of-life experience that we have right now. The doulagiver practitioner comes in and fills that gap. You're the eyes and ears for the hospice team. You're reinforcing the care to the families. You're making sure they know what to do. You're giving them the security that they can do it. So you don't do any hands-on care. Isn't that amazing, right? So that's another reason why teledoula is so effective, because you are that end-of-life coach. So that's why it's super important to be able to do it. Now, what can you do to be a tele doula? I'm going to give you first, let's go over the software and the things that you use with your practice as a tele doula. Number one, you can use texting. You can use Zoom. So Zoom is wonderful. That's a great capability. And again, they have really, because of the pandemic, what it showed us is that we had to flip everything into technology and online. They have really, really, again, great plans, I feel like, for somebody who is a private practice death doula. I have a much bigger plan because I have students, hundreds of students in semesters that come on, and we do coaching and we do practicums and all of the wonderful things that we've been able to do. So my plan is huge. But that's not what you would need. You would need a basic plan, something that allows you a certain amount of time. I even think there might be a free option that I think it only goes to 30 minutes. So if you're going to be a professional doula, you want something at least 60 minutes for, of course, your initial meetings with your families, which we'll go over in a minute. Texting, Zoom, FaceTime. So if you have an iPhone, you can do FaceTime. FaceTime is wonderful. It allows you to see what's happening in that house. So we've had family caregivers where they went in and they said, they showed with the FaceTime, this is what mom's presenting like today. She's in a sleeping coma. She's breathing really heavy. Her extremities are getting really pale. The caregiver's able to show what's happening there. We're able to tell them what is happening, the physiology behind it, why that's happening, and then the intervention, what they can do for comfort, or simply let them know that what they're seeing is a natural part of the end of life process and not to be afraid. It is so important that we are able to get on the same page with this and support patients and families. We have one opportunity to have that end of life go well. If it does not go well, they remember that forever. And if it does go well, they remember that forever. So here we are with Tele Doula. It's incredible. Text, Zoom, FaceTime, audio calls, phone calls. Beautiful. Skype. So you can use Skype. Maybe there's some people that you're working that really are familiar with Skype. And that's it's another way to be on with camera and work over the internet. So those are the softwares that we can use. So what I'm going to say now is critically important when you're starting your tele doula business or your doula business in general. Have a 30-minute free consultation initially. Offer that. Why? So many people do not know what a death doula does or a doula practitioner does. They're scared. They want to get to know you. They have to trust you and know that you have the knowledge that you can carry them through what they're looking for. They don't have probably time to do tons and tons of research, although I hope that we get to a place where people pick their doulas before we ever get there, what we want when we're doing our advanced planning. But for now, it's showing up when people are in it. They want it. You have to have that touch point. You want to share with them your knowledge. Where did you get your training? What can you offer them? So offering a 30-minute free consultation is critically important. And the 30-minute time frame is very important. Why? Because if you do an open-ended call and we're in this space, you could have a meeting for 3 hours with a family member. They're going to tell you everything, and I understand why. But they're going to tell you everything that goes on. They're going to tell you what's happening. You're going to want to meet them. You're bonding with them. You have got to be a professional, and a professional is going to be just this. Initial conversation. You ask that caregiver, what are their goals? What is their most important need right now? Because you want to go in order of acuity, in order of what they need. They might say, I need to hire some help. I need hospice on board. I need rest. I need rest. I need support. So you want to ask them, what is your greatest need right at this moment? And then you're going to ask on that initial conversation as well, what are their goals? If they had a complete goal for the best scenario and how this could work out, what would their goals be? It would be that mom would be comfortable and pain-free or relatively pain-free within this process and not afraid. And that my brothers and sisters would feel comfortable being here and being able to contribute what they can because they're petrified. And that we could plan a home wake so that we can just celebrate mom before the next phase, before she gets cremated or whatever she wants. So these are examples, again, of asking, what are your goals with this care? It gives you a blueprint to help them. Then you let them know if you can be the person that can support them in what their immediate need is and the goals that they have. If you don't know anything about what's a home funeral, or if that's something that just, or a home wake, that's something that just, you need to think about that. Because when you are, again, a practicing tele doula, a practicing death doula, you need to know all of the things that are out here that are part of this beautiful death positive movement that you can offer your families and your patients. That's what they're asking. That's what the service is. So again, you might want to consider, if you don't, and again, if you're thinking about this, make sure that you have training that encompasses the full spectrum of that end of life practitioner. So again, make sure that you hear what their goals are, and then make sure that you can offer what they are requesting. And if you can, you say, that's fantastic, because I have been trained and I have the knowledge in X, Y, and Z, and I can help you if you would like that help. Would you like to work together? Would you like that support? Yes. Now you talk about, how does that work? What is the next step? The next step is that you're going to offer how that works. So what is your fee structure? Making sure that you have a patient-family agreement, that you have a contract that is signed before you ever do a first session with them. You are a professional. Act like one. So you need to present it like one. Also, the agreement is going to be very, very specific on what you do as a death doula, doula giver, and what you do not do. You do not give medical advice. You do not give legal advice. You do not do any hands-on care. This is critically important, to be professional and very, very clear. What is your fee structure? So as we have talked many, many times, and it is something that we offer in the Death Doula Discovery webinar, we teach you how to pick your hourly rate. How do I know what to charge, Suzanne? How do I know what to charge? So where you are geographically located is a very good starting point to figure out an hourly rate. Then in your business building, we're going to teach you how to do packages. So you take that hourly rate, then you offer packages of 10 hours, 20 hours, 50 hours, and you bring down the hourly rate so they save money on buying packages in bulk of hours. And then we also teach you how to do a sliding scale. Critically important that we understand that this is a profession of purpose. This death doula, doula giver is a profession of service, fulfillment, and purpose. And that is what we're here for. The other part of it is all how we structure that we can continue to be of service. So having a sliding scale allows you, if you are open to that, most death doulas are, when you have a family that can't afford your hourly rate, they're not turned away from service, that we find ways to have a sliding scale for them. And then also, we have ways in Doulagivers Institute to offer pro bono hours to families that are in need, that need that doula, that don't have any resources. It's not ever about turning anyone away. It's about service. And it's about building a business model to meet the service and what is being asked of us out in the world. So very important that you subscribe to that too. That's how I teach our graduates, our death doulas. Of course, you can do what is right for you. But if you're not feeling the call to be a doulagiver practitioner or a death doula, and it is a calling, then that maybe this is not the best space for you. So this is, again, a calling of service. And if you have that gift to serve people at the end of life, this is what you're meant to do, and it will absolutely change your life. The business model that we share with doula givers is set up just for that, to be of service, to live a purposeful profession and have a way to do it that you're sustainable and able to continue to serve. So you want to share with them your fee structure. You want to have that patient agreement before you ever do the first session. Make sure that they sign, and that if they're buying packages or they're buying a few hours, whatever they're doing, then that's all taken care of. How do you collect the payment? Let's talk about that. So I want to keep everything on technology, because I think it's really important, if you are going to be a tele doula, to get very clear on all of your software and what works really, really well today in today's world efficiently for your practice as being a tele doula. So there are systems that can take payment like Zelly. There are, and that is something, I believe that is through Chase Bank, but it might be through some other banks as well. That's what I use a lot, is Zelly. You've got PayPal. Almost everyone is on PayPal. You've got square.com. So there's ways to set up systems that you can take payment. There is also, you can have a snail mail check signed and sent to you, but I'd be cautious of that for multiple reasons. Number one, people need your work right away. They need your help right away. They need it today. They need it yesterday. Waiting for that payment to come. What if it doesn't come for whatever reason? And you should never start cases without the signed agreement, without the first payment or the payment being talked about and done. You want to get the payments out of the way so you can focus on service. You don't want to be, okay, the person needs my help. Where is where is the payment? But their mother is actively dying. Like, do we not show up? Of course we show up. Get all the profession, get all the logistics out of the way first, and then open that heart and serve. So I want you to have a software that's instantaneously taking payment so you can get all of that done. Now get to the work. So Zelly, PayPal is a great one. Square.com does that as well. Okay. First visit. So let's just go over. I want to tell you what I recommend for your first actual tele visit is very, very important for multiple reasons. You're getting all of your information. You're also building the trust, or not building the trust if you don't show up correctly. So that's going to be, I say that should be at least a 60-minute visit with your caregiver. You want to spend time with them. You want to ask them how they're doing, get like the patient, all the information on the patient, and then ask the caregiver how they're doing. We have in Doulagivers, we have a patient care plan template, which has all the plug and play. Who is the hospice nurse? And I'll just give you some of the information that you're going to need. Who is the hospice nurse? What is their phone number to contact them? What is the on-call hospice number? Are they a DNR? Do they have a do not resuscitate? Do they have any allergies? What is their main diagnosis? Are they on hospice services with end-stage emphysema? This is big to know. Why? Because that's going to directly impact symptom management and quality of care. Tight symptom management, being ahead of it, is the difference that the doulagiver makes. So when I know, even before I'm working with a family, that somebody's coming on my services with end-stage emphysema, I know that I need to have my emphysema care plan, that it's going to be tight symptom management, that anxiety is going to be with part of that. It is a very intense disease process. So the disease will impact the care before they get to that very last 1 to 3 days of actively dying. You want to have that care plan template all filled out, interventions you're going to use, all of the goals of care, all of the beautiful things that we have in the Doulagivers patient care plan template. On that initial visit, have that all filled out. You don't have to try and remember any of this. That template for you, all you do is ask those questions and have it filled out. Ask the caregiver, how are they doing? And make sure you know that the immediate family members, how are they doing? How are your children doing? Whatever the elements are there, so you know that whatever interventions you have to put into play, that you will. Then, of course, make your next appointment. What's beautiful is that with these hour-long, or even then from there, you can maybe do 30 minutes on Zoom. So let's say you're doing initial Zooms with your caregiver. You can do the rest in texting. You can do the rest with phone calls, and it works out beautifully. So somebody doesn't have to move away and get the 30 minutes. They can be, and this is often what happens, in a room of somebody who's dying with all of the things going on and quietly texting the Doulagiver practitioner. This is what's happening. What do you think is happening here? Can you guide me on my next step? What should I know? Absolutely invaluable, the role that the doulagiver plays and the doulagiver plays. So that is your outline of what is a tele doula, why it's important, and what you need to know to become a tele doula. And I will say that Whether you are thinking, oh, I just want to be a tele doula solely, which is a wonderful option that you can. If you are a professional death doula, be a tele doula as well. Have it open. Why? It's organically going to show up. You're going to have situations where you can't get to the family. You're going to have situations where it's out of your service area. You're going to have situations where it's not appropriate that you physically go to the house. Know how to be a tele doula and serve your families through that medium. However, if you are open, you can become a tele doula and have a tele doula business with people serving them all over the world. And we hope you do. We need you. If you have any questions, please let me know. Put your comments below. Let me know what you think about tele doula, the questions that you have about tele doula. And don't forget that the Death Doula Discovery webinar is coming up so soon. That is live. I'm going to go through the whole process of how to become a professional death doula. So if you're interested, the link is in the show notes. Again, if you want to live a life of purpose that is of fulfillment and of service, if you're called to this space, meet me in the Death Doula Discovery webinar, and I'll see you there. Thank you, everyone. This was Ask a Death Doula. My name is Suzanne O'Brien. I'll see you in the next episode. Bye, everybody.